What is a stroke? The brain is a highly complex organ controlling motor, sensory, and cognitive abilities. It divides into two halves, called hemispheres, which receive and transmit information to each half of the body. Specialized brain areas control various activities for all functions of the body. The severity and the location of a brain injury will determine which body functions are impaired or lost. Cells, called neurons, make up the brain and are responsible for processing and transmitting information by electrochemical signaling. The neurons connect to each other into the parts of the body they control. An adult brain contains more than 100 billion neurons. To work properly, the brain needs energy and is, in fact, the main consumer of energy in our body. It's essential that all the parts of the brain receive continuous blood flow, carrying nutrients and oxygen that are critical for its normal functioning. What is a stroke? A stroke is a sudden brain attack. How do you know if you have a stroke? What are the common signs of stroke? Is one side of the face dropping or hard to move? One cannot raise the arms due to weakness? Or the patient is having difficulty in speaking? If you have these signs, time is of the essence. Call 911 or go to the nearest hospital. Think fast. What are the types of stroke? Ischemic stroke. Due to interruption of blood supply usually caused by a blockage of a blood vessel. Blockage is caused by a blood clot developing in the brain on cholesterol plaques or formed somewhere else than in the brain itself and migrating in a cerebral artery. Usually, 80% of stroke cases are on this type. Hemorrhagic stroke. Due to a rupture of an aneurysm or a weakened blood vessel resulting in bleeding in the brain tissue or surrounding the brain. Accumulation of blood in the brain tissue leads to the formation of a hematoma that compresses and disrupts the blood supply to the surrounding brain tissue. Symptoms of a hematoma depend upon their location, their size, and whether they cause associated swelling. Subarachnoid hemorrhage is a life-threatening type of stroke caused by bleeding into the space surrounding the brain. Subarachnoid hemorrhage can be caused by a ruptured aneurysm, AVM, or head injury. Transient ischemic attack. A TIA or transient ischemic attack is a mini-stroke that causes a brief interruption of blood flow to the brain. The symptoms are similar to an ischemic stroke, but TIA symptoms usually resolve within minutes. A TIA doesn't leave long-term problems most of the time. Therefore, TIAs go unreported. However, a TIA is a sign of an underlying problem that may trigger a stroke in the immediate future. Treat TIAs like a stroke. Go to the emergency room immediately for a physician to take preventive measures to reduce the risk of a stroke in the future. If there are signs of stroke, call 911 or go to the hospital immediately. If the doctor can intervene immediately, the damage to the brain can be arrested and the patient can have fast recovery. This information is shared by Neuroaid 2, huge boost towards recovery from stroke. Neuroaid 2 is exclusively distributed by ECHIMES Pharmaceutical Incorporated.